I'm not sure what brought you here, what your story is, or who you are, but if you've made it here and are willing to accept the help you need, then you're a strong person. Know that there is always someone in the world who cares about you, whether you know it or not. Trust that life gets better at some point, and the bad days don't last forever. I hope you find your peace and happiness in life. You deserve the very best.
I was somebody who went to Unit 23 as an adult for many years and walked that hallway. And the transformation, that's the part that I want to speak about. What it means to me to see it and to walk the hallway now. Over the course of the last 25 years, I've had numerous hospitalizations. And one of my favorite units, because of the size, Unit 23 is quite small. And so when you're staying that long, it is a safer space to be there. And as part of going down to Unit 23, there's this really, really long, and I'm going to say ugly, corridor. Coming back on a Sunday or a Monday, I would call that the walk of shame. So just going in there, you're like, okay, so this is the space for us. This is where we belong, right? As opposed to walking down this beautiful, long, colorful place with inspiration and hope.
It began in January 2018, and it was inspired by patients and families about wondering what we could do to make our clinical settings less institutionalized and more teen-friendly. Through an informal conversation with Carol, who is one of the members of our committee soon to develop, we earmarked the hallway as a place to begin. The hallway is a high-traffic area, well utilized by both treatment teams on 23 and 26, and of course the patients and families that we provide care to on those units. And also because transitions can be hard for our young people, and whether it's their first steps coming to us at the time of admission, or it's gearing up for a transitional pass, or it's getting ready for discharge, like actually going home. Transitions can be filled with a lot of anxiety and trepidation and fear. We wanted our key transitional space to be one where young people and their families could feel seen and safe in their vulnerability, where they could also be inspired for the next stage in their journey, whatever that leg of the journey was for them, and grace for the next step.
You know, trying to put yourself in the shoes of somebody going through that period in their life, then potentially walking down a long, dark institutional hallway on the way to an inpatient unit is frightening in itself. And so when the Hope Hallway project was first brought to our attention, you know, being asked directly, would you like to be involved with this work? It was truly a no-brainer, because it was an opportunity to make a difference for the kids who are going to come later. And if we had an ability to apply the lens that we bring as either patients, families, parents, that was easy to give back, because we knew that the benefits were going to be huge for kids who are walking down that hallway at that stage of their life.
So we really, right from the get-go, we were committed to the idea that we really need the kids to tell us, and families to tell us what would make you feel better when you got off that elevator. We had families and kids vote for colors. We had families and kids vote for what they'd like to see in the hallway. We asked them what they find calming. And then as a committee, we sat down and went through all of them and picked the top 2 of each category. What makes you feel calm? What are the colors that you find welcoming? And then we just sort of rolled with what they told us.
I have to say, it was an honor to be asked to participate in this. everything they did was based on family and patient feedback. This space was not created for them. It was created for the patient and for the family. And if they could make one piece of that journey feel a little bit better and feel a little bit calmer, they were all about that. We did some mosaic tiles, and I am not very creative or artistic, but it was guided, and they had a lot of local people come in to help us, right? So I just remember creating tiles, creating things that they assembled and put together to make this beautiful piece of art. They created things out of skateboards that were being tossed away, like everything that appealed to youth. They took into account identities and feelings and everything that different youth are going through and different reasons why they're on that unit. They took that into account, and they did not do one thing without asking for, is this right? Is this what you'd like to see? And if you had an idea, they thought about it and said, okay, well, if we did this with that idea, would that be all right? Is that what you were thinking? So it was fantastic.
One of the things that really inspired me was watching how the patients collaborated with each other and the time they took to discuss what they wanted to see. And, there weren't always agreements. Sometimes there was really robust, interesting conversations as to what was important and what wasn't important. And so I really appreciate sitting back and listening to the youth talk about what was important to them. It was certainly a different perspective than my own. And I learned quite a bit through working with these patients. We also had a lot of wonderful conversations. Everything I know about NBA basketball, I learned from the patients. What we posed to the patients was, when you're doing the work, when you're making your tile, and when you're choosing the design, we want you to keep in mind what gives you hope, what makes you feel good, what brings happiness to your life, what brings joy. And it could be anything. It was so open-ended. And so when you take a look at what's on that mural, it's so interesting to see what brings happiness and joy to everybody. It could be as simple as a slice of pizza. It could be a really, old, worn-in shoe. For somebody, it was fresh laundry hanging on a line. When you look at the mural, you're going to see so many different imagery. It's just so impressive and interesting to see what everybody decided to put on there to share and to express what joy and hope meant to them.
The future for healthcare buildings and facilities really isn't about the new, it's about how we refresh and repurpose the existing. We have hundreds of corridors in our buildings here, and several different buildings that house patients and families and the people who care for them. So we don't want every corridor to look the same, but we do want every corridor and every care space to be, improved and refreshed where it can be, and really try and meet the needs of patients and families. So I'm proud of them contributing to that sort of positive energy and refreshing of our spaces.
I hope this inspires other people to do it in their service areas with their patients and families. I think it's a lot of work, but it has such great reward, and if we can create those opportunities for people to engage and to really bring out that side of humanity that we all share, those common elements in humanity, where we know what it's like to be stressed, we all know what it's like to be in an unknown situation that creates anxiety or fear for us, and even more so when we're accessing the health system in a time of crisis, whatever that might be, mental health or physical health crisis. We want to be supported and we want to feel safe and comforted. And so again, just taking the time to do this as far as making adjustments, small shifts and changes within your clinical setting to make that difference is wonderful. If people can do it, I would really encourage them to do so.
Our minds are the ones with hope, because hope has to come from somewhere. Fire doesn't start without a spark. Hope doesn't spread if it's not there. So let's make the hope. No, let's be the hope.